March is Macular Degeneration Awareness Month and Low Vision Month, and any problem you have with your sight can certainly cause big problems with your overall life. So it's important to make sure that you get the proper screenings, diagnosis, and treatment. And here to tell us more about all of those issues, we're so pleased to have with us today Dr. William Wood, an ophthalmologist with Retina Associates of Kentucky. Thank you so much for being with us today.
Thank you, Christy. It's really important because macular degeneration is a leading cause of blindness in this country today. And March is Macular Degeneration Month and Low Vision Awareness Month. And early diagnosis and prompt treatment is a key to saving vision in this important problem. So we're really glad you're helping increase awareness of what's going on.
And you hear so often that why it's so important to get that early screening is that once vision is gone, there's not really anything you can do to restore it. You have to work so hard to prevent the additional loss by getting the problem found out early, right?
Well, that's generally true, and as a matter of fact, the better vision that you would have if you would be diagnosed with it, the best chance you'd have to keep that vision the rest of your life. Unfortunately, we see people who've lost so much vision before we can begin to do anything that it really is almost too late in many cases to help tremendously. But in this particular disease, with the treatments we have now, we can often take someone who may be legally blind when we first see them, unfortunately, and restore driving and reading vision again.
Wow. And I know that you guys have a lot of technology. Tell us about some of the options that folks have as far as getting treatment.
Well, as far as treatment goes, there are two types of macular degeneration. The most common type is a dry type. And in that type, there's usually mild visual loss. And we have certain very specific mixtures of vitamins and minerals that can reduce the progression of loss of vision by at least 25%. The second type of macular degeneration is called wet macular degeneration, and that causes usually a severe loss of vision, but even so, people usually retain their peripheral vision. For treatment of that, we have a whole series of treatments ranging from a thermal laser treatment to cold laser treatments, where we combine special photodynamic drugs with lasers, to the newest form of treatment, which is a gold standard, which are injections into the eye of a chemical that blocks the growth and leakage of blood vessels.
Now, we want to make sure that we give you the details on a special event coming up next month to get more information on macular degeneration. That's coming up Saturday, April the 10th there. It's free, a chance for folks to come ask their questions and find out what they need to know.
Absolutely. It's free at Hamburg Place in the Regal Cinemas, easy parking. And we encourage everyone to come in around 9:30 in the morning, and you can hear all the latest information about research and treatments, and I have all your questions answered.
And the website, we've been running that at the bottom of the screen, and the phone number for Retina Associates of Kentucky if you want to get information. And if folks are having symptoms, they need to come in and get checked out.
Absolutely. Anybody over the age of 50 needs to have an eye examination regardless, but anyone under the age of 50 or over the age of 50 if have symptoms of loss of center vision or blurred vision needs to have an immediate eye exam through a dilated pupil.
Well, thank you so much for taking the time to share that information with us and our viewers. We appreciate it.
Thank you very much, Christy.
We will be right back with a check of your forecast.